Thank you. My name is Alice Linahan, and I am the Vice President of Women on the Wall. I'm speaking as a mother, and I am against Senate Bill 10. The intention of wanting to help someone doesn't actually mean those people will be helped. How many times has law and policy been written under this pink dome out of good intention, and the very people who are supposed to be helped are actually harmed? The reality is, more often than not, solutions that we lob over, like a Scud missile, like Senate Bill 10, Senate Bill 11, and all the other mental health legislation, as a mother, I believe will fail. And the research actually shows that it will harm Texas students. We know from history that if politics and money were the solution, we would not actually have a need for all this mental health legislation. With the college and career readiness, Common Core aligned standards mandated on our school, we shouldn't be seeing this huge uptick in mental health issues and suicides. But since the 60s, since these government interventions into our education system have been put into overdrive, our education system has deteriorated, our suicide rate has skyrocketed, and our children are being used as research guinea pigs. At the present time, the American Pediatric Association Diagnostic Handbook, before it was published, or as it was about to be published, this is a quote. It said, "At present, most psychiatric disorders lack validated diagnostic biomarkers, and although considerable advances are being made in this arena of neurobiology, psychiatric diagnosis are still mostly based on clinician assessment." And there are many similar quotes, but here's just one more from the World Health Organization. It is very important because it deals with even more complicated developmental issues that prevent accurate pediatric diagnosis, especially in children and teens. Childhood and adolescent being developmental phases, it is difficult to draw clear boundaries between phenomena that are a part of normal development and others that are abnormal. I'll close with this. All of these issues raise huge privacy and family consent issues. This is especially true when there is already troubling overlap between academic data that lives forever in student longitudinal database systems and medical, social, emotional, and psychological data that is collected. And now, because FERPA has been gutted and our children's private data can be collected, it is incumbent upon you to do everything that you can to protect our children's privacy, because all of this data that collected will follow these children for the rest of their lives, from preschool through the workforce. And this has great concern.
Are there any questions of Mrs. Linahan? Dr. Zettel has a question.
Thank you. Could you give me a little more depth on what you're talking about, the other data that's collected other than academic, the social
Emotional learning.
Right.
And when you listen to SB10 and the other mental health, Senate Bill 11 that are going through the system, it's clear that federal grants are coming in, and that there is a push for social and emotional learning by the counselors. And everyone's buying into it because we've had these tragic shootings. But what people don't understand is that psychological behavioral data is being collected, and through the next generation of assessments and accountability, which when Larry Taylor talked about the Senate Finance Bill, he said that the STAR was going to go away and we were going to have online adaptive assessments and instruction. And your You've already received the next generation of assessments and accountability. And the number one recommendation is online adaptive assessments and instruction. Those assessments are behavioral. So that's behavioral data that's being collected by the school. Those counselors come in, and that data goes into the statewide longitudinal database system. Because FERPA was gutted, and because of the passage in January of this year of FEPA, the Foundations for Evidence-Based Policy makes legal the interoperability of all of these agency databases. So this behavioral data that is collected, when you merge these mental health bills and education, this data gets merged. And that data will follow our children now, because we're no longer a K through 12 system. You all know that. We are a P20W system now. That stands for preschool through the workforce. So this data will follow these children for the rest of their lives and could impact them getting future.
So they're not just collecting it collectively, they're collecting it on individual students, and it's identifiable as an individual student.
Yes, because the federal government passed WIOA, the Workforce Innovation and Opportunity Act, and so when the state takes those grant dollars from, and what WIOA did is it binds education under the Department of Labor, Department of Health and Human Services, Department of Defense, and Department of Education. And in those documents, when the statewide longitudinal databases collect data, it specifically says at the individual level.
Thank you.